Hi, everyone. This is Terrence Chang, Chancellor of the Connecticut State Colleges and University System. I'm the host of this podcast, Office Hours. Through candid discussions, Office Hours will explore the intersection of education, leadership, and economic growth. We will hear from state, higher education, business, and industry leaders and students and faculty who will share valuable perspectives that inspire and empower listeners on their educational and professional journeys as we delve into the key issues impacting higher education across Connecticut. Joining me today is Nestor Leon, Project Director with CSCU, where he manages the CT Health Horizons program, a statewide $35 million healthcare initiative with more than 20 partner institutions. In this role, Nestor has worked to expand nursing and social work practitioners over the next 3 years, establish protocols and procedures to quickly align initiative goals with contracted partners and convene system partners to develop seamless delivery systems. Prior to his role at CSCU, he served as Vice President of Operations for the Workplace, Inc. in Bridgeport. Nestor, welcome, and thank you so much for joining me today.
Thank you, Chancellor. Thank you really for this opportunity to highlight the amazing work around Health Horizons. And a little bit about me. I'm coming out of workforce development. I've got 20 plus years in kind of a progressive responsibility. And what really attracted me to, the CT Health Horizons opportunity was really the emerging need for a statewide approach to addressing both nursing and social work pathways. So I'm excited today to talk to you about this.
That's awesome. I appreciate that. The work is amazing. The grant is great. I know you've been doing a wonderful job of stewarding this grant. But before we jump into that, I would love to hear a little bit more just about you, right? Like, how did you kind of get on this path? What has that journey been like that has led you into workforce development and now working for a great system like CSCU?
So my path is actually pretty non-traditional. Completed high school under the traditional way, and then became a dad, and didn't go to college immediately. When I did, I actually went to Capital Community, started there. Took me a little longer than the 2 years to do the associate's degree, obviously because I was balancing work and all the family responsibilities. And then it really wasn't until I was actually working in the workforce that I really identified the need for me to have my higher ed education. And thankful, to the organization that I was with that they made that investment in me. And I went and pursued both my master's and my MBA.
Awesome. That's great. I love hearing that. And that's really why, with guests like you, I want people to understand kind of who we're talking to, right? The fact that not everyone takes a kind of straight line to where they go. Life has wrinkles and we have to deal with them. And your story and now your work and your body of experience is really, really key. So thank you for sharing that. So let's talk about CT Health Horizons. Talk a little bit about how this 3-year, $35 million initiative is addressing the state's workforce shortage in nursing and social work, and how has that funding kind of flowed and been utilized?
So Health Horizons was established as we transitioned out of the COVID era. COVID placed unprecedented stress on our economy, but more importantly, on our healthcare and behavioral health systems. This innovative model that creates homogeneous governance between public, private, and UConn institutions delivers seamless service integrations benefiting students, the higher education system, and ultimately employers. Through 3 strategic pillars, Health Horizons is addressing the nursing and behavioral health challenges statewide. That first pillar is scholarships, targeting financially eligible nursing and Masters of Social Work students with up to $10,000 per year for up to $20,000 in total, reducing the financial burden to attend and remain in programming. Faculty expansion, the second pillar, providing financial supports to hire faculty and expand both nursing and social work opportunities statewide, bringing new programs online and reducing class sizes. And the third pillar, innovative programming. 10 nursing and 6 social work innovative programs, partnering with high schools, businesses, and hospital groups, advancing access and partnership while testing new service delivery models.
Yeah. Yeah. That's awesome. I mean, let's unpack some of these pieces, right? Because I think that's really important. So first and foremost, I think we understand that scholarships and funding is really helpful from a kind of macro perspective. But I don't know if there's anything you can share specifically about the impact that this funding and these scholarships have had, maybe specifically on the CSCU students, the CSCU programs. You know, I think we all take a lot of pride with CSCU being access for a lot of folks who might not have that access otherwise. So maybe talk a little bit about just the scholarships piece.
The scholarships were designed to kind of do two things. First one was to remove a barrier to entry. We want to diversify both the nursing and the social work pathways. And what we were finding was that many students did not have those financial resources to enter into that. And the second piece was to reduce the kind of attrition rate for students, and particularly students of color, because of their dependency or need to some type of financial stability while they're in long-term programming. So in the scholarships, let me give you some highlighted data around the scholarships. So the original proposal for CT Health Horizons, the goal was to issue 1,250 scholarships over 3 years. Chancellor, I'm happy to tell you that in year one, we issued 591 scholarships, or 131% of goal. And in year two, we issued 1,071 scholarships, or 238% of goal. So when you combine that, that's 1,662 scholarships over 2 years, or 132% against the total grant goal.
Yeah, that's incredible. That's really incredible. And that's amazing to hear, because again, those are people that without that support may not have been able to enter these programs. And those are people that they're going to finish these programs. They're going to go into the workforce and social work and healthcare and nursing. That's a major, major impact. Let's talk a little bit about, just shed a little light on this, right?
Sure.
The nursing and social work programs are not your traditional academic programs, right? English or history or political science. I mean, these are, especially in nursing, high overhead programs, really specialized faculty in nursing and social work. And then the programs themselves, like you said, there seems to be a lot of connectivity between the high schools, our programs, and the businesses. So maybe just talk a little bit about that, the faculty specialization and the uniqueness of these programs.
Sure. So under that second pillar, that faculty hiring, we have a goal of 99 hires over 3 years. Over the first 2 years, we've already hired 73 faculty statewide, 32 of those being multi-year positions, meaning that those are creating stability and expansion at those institutions. And these faculty positions have brought on additional clinical opportunity, classroom opportunities, and support positions, which in turn have impacted our attrition rates. Just to give you some data, Health Horizons affiliated registered nurse programs preliminary data shows that the average attrition rate is just 2.7% in 2024. When we compare that to 2023 statewide sample, it was 7%.
Wow. That's a huge, huge improvement.
Yeah, this clearly demonstrates, a real improvement in student retention, and that's likely driven by this faculty support, smaller cohort sizes, expanding student resources, and having additional time to focus on studying rather than on financial stability is producing these amazing results.
Yeah. Yeah. So let's talk about some of these programs as well, right? The funding has clearly helped the students. It's clearly brought in faculty, but the innovative programming, I think, is what's key. So maybe talk to us a little bit about the development of some of these programs under this CT Health Horizons umbrella.
Absolutely. So there's 16 innovative programs, and the innovative program model design is really that an institution of higher education has to partner with another system partner to go out and either create something new or expand upon an existing program. So under the original round of innovative programming, we really sought to create new programming, to really look at, where are the gaps and how do we close those gaps. So to give you an example, Eastern Connecticut State University's nursing program. It's a startup program. Through Health Horizons innovative funding, they've been able to secure state-of-the-art nursing equipment to bring the Bachelor's of Science in Nursing to that university. The Southern Connecticut State University has an innovative program in their social work side that has partnered with two community health providers, where they are sharing those master's level graduate students with those community providers. In turn, the community provider is providing leadership and management supervision to those students and releasing their staff to go to Southern to attend the master's level program. So it's a real win-win type of program. And Central, I've got to tell you that, Central has just stood up their master's in social work program, and Health Horizons has provided financial support through scholarships. They had a target of 10 master's level students. Super happy to report out that we're at 16 master's level students, and they have one of the highest diversity rates in any master's level program in the state currently.
Yeah, that's awesome. That's awesome. I mean, again, I think it's pretty clear, just given the statistics that you have provided, that, we're entering Health Horizons' third year, and you've already overshot so many of the goals that were established at the beginning. So, I mean, talk about what year 3 really looks and feels like right now. It's been a success. How much higher can we go?
Well, we're in the midst of year 3. We know that we've got obligations to a high number of students that are already in our scholarship pool. We know that we've got faculty that are continuing on, so we know we will exceed that 99 benchmark for the total grant. In 2024 alone, Health Horizons created 138 new student seats in the registered nurse program. That's 138 more futures launched in the profession that we urgently need to grow. And that combination of new seats and improved retention will steadily increase the nursing cohort statewide. So, yes, Health Horizons is exceeding all of its metrics, and in its current year will issue those additional scholarships and faculty hires that would push those numbers even higher. And although that's all great news, the reality is that the demand side needs substantially more new nurses and behavioral health graduates to meet the need. And that's why continued funding for Health Horizons is critical. It's critical to the state.
Yeah, absolutely. Absolutely. I mean, I think it's a great model as well to have this kind of work happen with the state investment and have an impact across the board. So you said we're in year 3. I presume you personally would like to see this kind of work continue. I would love to see this continue. Tell us how we can take the momentum and the progress we've made and, potentially turn it into a long-term opportunity for the whole state.
The reality is that while Health Horizons is addressing this workforce shortage, it is not fully eradicating the need. When you look at, like registered nurses, for an example, it's the most in-demand role in Connecticut across all industries. You're looking at 12,700 registered nurse job postings just in the last 90 days alone. When you talk to our state partners, DCF, DSS, DOC, they have a critical need for skilled nursing and social work practitioners as well. Both those registered nurse jobs and those social work jobs, based on labor market information, have a 6 or 9% increase through 2029. The truth is that, there's a couple things that we believe that Health Horizons 2.0 could really strengthen the system. We see the need for those financial supports to individuals. Currently, right now, we're funding 3rd and 4th year students on the nursing side and only master's level students on the social work side. Obviously, if there were resources, we'd like to go in to those student pools much sooner, remove kind of that financial burden and give them the opportunity to fully invest in their education. We'd like to create long-term strategies with the institutions of higher education around faculty and really create kind of a sustainability plan where we can roll some of these faculty off in a staggered way. So right now we are funding 100% of those positions, but maybe in Health Horizons 2.0, we can reach an agreement that for a durational period, we would fund the position, but then the institution would assume that responsibility, keeping that expansion in the state.
Yeah, that's really helpful to understand your perspective of future potential. And as we near the completion of this program, and like you said, look towards hopefully what is a 2.0 version and eventually a 3.0 and so forth, you're going to be an instrumental author of not just the report out, but the potential proposition for continuing this work, right? So that's really key. So let's do some lighter questions, let's say. You mentioned earlier, we were chatting, so you had a child, earlier in your life. How many kids do you have, if you don't mind me asking?
I have two. So I have a 33-year-old son and I have an 18-year-old daughter. So I thought I had a built-in babysitter, but my son went off to school.
No, I don't think it works that way. I don't think it works that way. So I'll start a few kind of like rapid fire questions, right? Like, what's your favorite thing to do with each of your kids?
Me and my son, I kind of say we kind of grew up together. So yeah, we definitely like the outdoors. So any sporting event or anything like that, we're definitely there. My daughter is a little different. Definitely more movie nights.
Mm-hmm. Very cool. Very cool. Any particular kinds of movies that you guys prefer?
And she likes drama.
I can never settle on a movie with my kids. So we just got to the point where I just, my wife will just say, this is what we're watching. And if you want to watch it, great. And if you don't, so be it. All right. So quick shift then. I mean, what are you seeing from your seat regarding higher ed? We're in a really difficult, I would say, kind of historic time, right, for higher ed. I mean, do you have any prognostication, anything you see evolving in the next 10 years?
I would like to see, more strategic alignment with workforce development. Oftentimes, the educational system is thought as just a training provider, but the truth is that we've got a really strong pulse to business and working in concert with workforce development. Could streamline, some of our processes, but ultimately really develop that talent pipeline there. The move to online, I think, is inevitable, but I also think there's got to be a bridge program because there's a subset of the population that has a relationship with technology, but not a strong enough relationship to use it as a learning tool, and I think that's got to kind of be fortified.
Absolutely. Absolutely. Do you have what's the best piece of advice you could give to a student that's either in college or getting ready for college?
Yeah, take advantage of all the services that are available to you. I recently conducted my monitoring of all 22 institutions under this particular agreement. And I will tell you that I was taken aback by the level of supports available to students. I'll give you an example. Western Connecticut State University, under this particular initiative, is supporting a tutor, a dedicated tutor for math and sciences. And the uptake rate is 100%. And the reason it is because it is intentional. They go after the students and they meet those students where they're at. They're seeing a very low attrition rate in their program because these students, one, are getting the educational supports, but two, are feeling a connection to the system. And I think that's where our strength is. We've got to make people feel connected to the larger system.
Yeah, absolutely. Absolutely. That makes a lot of sense. So let's talk a little bit about a skill or skills that you think all students should have or should acquire.
I think networking is an absolute must. I think that, in today's digital world, it's very easy to kind of respond electronically, but that face-to-face connection and that ability to communicate and interpret those communication cues can't be lost. And I think, students really need to make an investment in that.
Absolutely. Absolutely. Do you have a favorite sport?
Baseball. New
Okay.
York Yankees fans.
I was going to say, the next question is favorite team. And you just said the Yankees. So careful, you're in Connecticut. So you never know if you're in Red Sox land or in Yankee land. So
It's 50-50, but
it is. It is. And what do you do as like a hobby? Like, how do you decompress? How do you just spend a little time for enjoyment for yourself?
I took up photography a couple years back. I bought some relatively basic photography equipment, and I've been progressively moving up that particular ladder, and I enjoy that.
That's cool. That's great. Well, Nestor, it's been a real pleasure talking to you, getting to know you a little bit more. And I'm really grateful that we've had, you and someone like you stewarding this grant forward these past few years and all the way to the end. It's obviously making a massive impact. And I can't wait to see the end results and just feel those impacts as well, because this is how we move the needle and change the game and help people's lives. So thank you for all the work you've done.
Well, thank you for your kind words, and thank you for putting an infrastructure, because we've got a great team, at CSCU, from leadership all the way down. Their hearts are really in the work that we do. And I really, really appreciate that.
Awesome. Well, thank you for tuning in to Office Hours. I'm Terrence Chang, Chancellor of the CSCU system. Please be sure to subscribe to our podcast and listen in to future episodes where we discuss the importance of higher education and why higher education should be a part of Connecticut's growth strategy with state and business leaders and students, administrators, faculty, and staff.